How do AMD treatments work? So treatments for wet age-related macular degeneration are given through injections into the eye under a local anaesthetic, and the way they work is by targeting the protein or chemical that's upregulated or increased in wet age-related macular degeneration, and that protein is vascular endothelial growth factor. But from a practical point of view, when you come and see me, if you need an injection, there's practical points that we need to discuss and need to consider. The first thing is really that it sounds a whole lot worse than it actually is. Most of the patients that I see or in fact all of the patients I see are acutely scared about having injections. However, once we've actually explained to them what's involved, the fact that we actually use strong local anaesthetic drops to numb the eye so that they don't feel anything during the time of treatment, and indeed once I've explained that the treatment itself takes a few seconds and it's the preparation that takes longer, patients are usually very comfortable about having their first treatment. And after their first treatment, patients come back for more treatment to help us stabilise the condition. So this shows that it sounds a lot scarier than it actually is in practice. When patients come to see me, we start out with drops to dilate the pupils and to have a look into the eye. When we've established the need for treatment, we put local anaesthetic drops into the eye to numb the eye, and then we clean the eye very thoroughly. And that's because the main risk of treatment is infection. And so we do all we can to prevent infection. Once we've cleaned the eye and sterilised the eye very thoroughly, we put a clean drape over the eye and use a small clip to keep the eyelids open. With the eyelids open, we're able to carry out this very small injection into the white part of the eye. And the other thing that people are concerned about is whether they're going to see the injection being performed. And I ask patients to look in a particular direction, which is away from the place that we actually do the injection, so thankfully people don't actually see the injection at the time of treatment. Even though most or all people I see are very worried about the prospect of having injections, all of the patients I've seen actually are very comfortable with the process once everything's been explained to them and we've spent appropriate time answering questions, and they're very comfortable to lie down, have the eye drops and actually have the procedure performed without any problems at all. And they walk in, have the procedure carried out and actually then walk out again with their eye drops ready to go home within a few minutes of having the injection.